Hello, everyone. I am Dr. O. I'm from the organization Human Service Consultants. I like to speak with you about anxiety disorders. We all have anxiety from time to time. That is a normal occurrence. But when anxiety is to the point that you feel overwhelmed and tense and have feelings of dread almost every day, then that is not normal. And that is the time to seek treatment. Now, we have two categories of symptoms that I like to discuss with you. The first category of symptom is the emotional type. This is when the person is feeling apprehension or dread, feeling tense and jumpy, restlessness or irritability, anticipating the worst and being watchful for signs of danger. Now, the physical symptoms include a pounding or racing heart, shortness of breath, upset stomach, sweating, tremors, and twitches, headaches, fatigue, and insomnia, upset stomach, frequent urination, or diarrhea. Now, the anxiety disorders come in different types. Anxiety is the large umbrella, but under the umbrella of anxiety disorders, we have different types: panic disorder, phobia, generalized anxiety disorder, social anxiety disorder. And one that is not represented in this particular presentation is PTSD, and that's post-traumatic stress disorder. Now, before you get to the point of post-traumatic stress disorder, the person from day 1 through day 29 of the trauma occurring will have what we call acute stress disorder. Now, acute stress disorder can resolve within, I say, a 1 to 29 day period. But once that person hit day 20 and the issue has not resolved for that person, then it's recategorized as post-traumatic stress disorder. Now, let's look at some of these categories. The panic disorder. Before you are diagnosed with a panic disorder, you have a series of panic attacks. Now, basically, this is when you have the sudden feeling of terror for no reason at all, and it strikes up repeatedly. And some of the physical symptoms include chest pain, heart palpitations, dizziness, shortness of breath, and a stomach ache. So your stomach is pretty much upset because you're that nervous. Now, to move to the second category, phobias are based on fears. So that's the fear of a bridge, the fear of a snake, the fear of bugs, the fear of airplanes, any type of fear that a person have, and they are avoiding that particular object or thing, then it is considered a phobia. The next category is generalized anxiety disorder, and we call it GAD. Now, GAD is all about the person worrying all the time. They worry about this, they worry about that, they worry about this, they worry about that. So they just worry about everything. They're in constant worry state, and they can't let it go. So as a result, they have worry, headaches, tension, and nausea. The next category that we'll speak about is the social anxiety disorder. This is when the individual is not shy, but whenever they're in a particular type of situation, then they will experience some type of fear. Now, the situation is being in a social type of environment. They're afraid that if they say something, the other person may perceive it as being stupid. So they try not to say anything because they are really people who would rather isolate than to be in a social situation. They're afraid of the humiliation. Now, what's not represented here is PTSD. That category falls under trauma. So anytime a person experiences any type of trauma, it could be a rape, it could be war, it could be molestation, it could be someone robbing them, any type of trauma that you can think that the person may have experienced could lead to PTSD. So what are the causes? Why does this happen for some people and not for other people, to the degree that it happens that they have to see a therapist or receive medication because of the anxiety disorder, whatever the type? It could be because of genetics. Anxiety tends to run in large numbers in particular families. So if it runs in families, then it's genetic. It could be because of a stressful or traumatic situation, such as abuse, death of a loved one, violence, or prolonged illness. So PTSD is the result, as we discussed before. Now, the diagnoses of these particular disorders are done with what we call the DSM-5 statistical manual. And it tells the clinician, the therapist, the psychiatrist, the psychologist, the substance abuse counselor, the social workers, exactly how to diagnose a person with these types of disorders. So we have to actually know the criteria, or at least have some idea, so that when we're talking with clients, then they are expressing how they feel. And as they're expressing how they feel, if you know your DSM-5, then you can pretty much say, well, it sounds like it is this particular disorder. And then you go to the DSM-5 and you look up the criteria to make sure that you're straight as the clinician. And once you're straight as the clinician and you know that the client have met the criteria, then that's when the diagnosis is given to that particular client. Now, what is the treatment? The treatment includes psychotherapy that comes in the form of CBT, and CBT stands for cognitive behavioral therapy. Now, in this particular therapy, what we do is we try to help the client to change irrational thinking into more rational type of thinking. So it would look something like this. The client may make a statement, and the statement may sound negative to the therapist. And the therapist may say, well, try to say that same thing that you just said, but put it in a more positive light. So what we're trying to do is change the negative thought to a more positive thought. And it also will come in the form of taking away negative affirmations and putting it into positive affirmations through self-talk. That's an example of how we use CBT. Now, as far as the medication is concerned, anti-anxiety medications and antidepressants can be given to the client. It just depends on how the psychiatrist view the particular disorder and what that psychiatrist or physician would like to order for that particular client. Now, the final category falls into complementary health approaches. So that is your stress and your relaxation techniques. And as we know, it falls into the form of meditation, deep breathing, relaxation, listening to relaxing sounds. So that ends my presentation on the anxiety disorders. And if you have any questions, if you're my client, you know how to reach me. If you're someone else's client, please contact your therapist. If you feel that you have any of the symptoms, please visit your physician's office or a therapist's office. Thank you so much for your time, and stay blessed. And you know what to do. Love always.